everyone, and welcome to another episode of Infectious Conversations. This is WVU Medicine's Infectious Diseases podcast, and I'm your host, Dr. Meera Mehta. I'm a clinical infectious diseases specialist, and I've been working at Ruby Memorial Hospital for approximately 9 years now. So thank you for joining and watching this episode. So today we're going to be talking about a very deeply meaningful topic. We're talking and shedding light on the incredible work that's being done at the Positive Health Clinic. This is a clinic dedicated to not only treating patients with HIV, but also providing them with support and hope. Joining us today is someone who's made it their mission to help treat these patients in the Positive Health Clinic, Annie Behr. Annie, thank you so much for being on the show. If you don't mind sharing your current role and also how long you've been at WVU Medicine.
Sure. Thank you so much for having me. I am a registered nurse, and my role currently at the Positive Health Clinic is that of the clinical coordinator. I've been in this role now for 4 years. Prior to this, I operated as a nurse educator, so making sure I was available to patients to educate them on HIV and a variety of other healthcare issues. But I've been in HIV care and advocacy for more than 20 years.
Wow.
I've worked as a medical case manager for a housing program and also for a separate Ryan White case management program here in West Virginia.
Wow.
So I've been in the field for a long time.
Oh, for sure, definitely. Well, thank you so much for sharing your expertise with us today. We're really happy to have you on the show. Now, I do ask this from every guest on the show, but what is one fun fact you can tell us about yourself?
Ooh, well, the big thing that's happening right now, my son just made the WVU drumline. So he is a member of the Mountaineer Marching Band, which makes my husband and I were both alumni very, very excited for games this season.
So cool. That's Congratulations.
Thank you. Very exciting.
All right, so let's talk a little bit about HIV. So HIV, of course, stands for human immunodeficiency virus, and essentially it is a virus that can attack the human immune system, specifically white blood cells called CD4 cells. And if left untreated, this disease can actually progress into AIDS, where patients can actually become infected by these opportunistic infections. So these are pathogens that typically, in people with healthy immune systems, they don't typically get affected by it, but with patients that might have end-stage HIV or they might be in AIDS, they can get infected by this and have detrimental outcomes, unfortunately. Now, the good news is that there are plenty of prevention and treatment strategies for HIV that we'll definitely delve into. But first, I wanted to talk about how does HIV affect home? So, and do you have any statistics about HIV in West Virginia?
Yes. In West Virginia, there are approximately 3,100 people living with HIV currently in the state of West Virginia. And just to compare it to nationally in the United States, there's roughly 1.2 million people living with HIV infection across the whole country. We do know there's a percentage of people that don't know they're diagnosed. Nationally, there's 13% of people don't know that they are living with HIV infection, and we know that that's where the majority of new transmissions come from. And unfortunately, in West Virginia, that number is a little bit higher. It's closer to 27% of people living with HIV don't know that they have it. And so our goal is always to make sure that people are educated in knowing that they should learn their status and getting healthcare providers to consider adding an HIV screen to just basic testing.
For sure, absolutely. It's very, very important for people to know their status, and that ties into the incredible work you all are doing at the Positive Health Clinic. So can you tell me a little bit about the Positive Health Clinic, and also what does a typical day look like for you there?
That's wonderful. So the Positive Health Clinic has been in existence for 21 years now.
Wow.
We are grant funded, so we applied for grant funding originally in 2003 to prove that there was a need to provide HIV care in the area. And after that 1 year sort of fact-finding grant was approved, we were then started our clinical care in 2004. So just last year we celebrated our 20th anniversary. We're very excited about it. It's surprising to me, though. Sometimes there's a lot of people that don't know we exist and don't know the care that we're providing. So it's nice to be able to talk about it in this setting. I think think as opposed to a typical day, I'll maybe share with you a typical week.
Okay.
So we see patients in the clinic out of the physician office center here in Morgantown every Tuesday and Wednesday. And so Mondays are spent gearing up for clinic that week, making sure we know who's coming in that week, figuring out a game plan for anybody that we know has any particular healthcare or social needs so that we can address it with them in person when they attend their appointments. And then following Tuesday, Wednesday, Thursdays, and Fridays are really about wrapping up the week. What are things that came across when a person had their labs checked that we weren't aware of? Did they have a change in their liver function? Did they suddenly get identified as having an STD that we can help them get treated? And we're just tying up all those, any loose ends that maybe came about from clinic.
For sure. Yeah, it's a very comprehensive clinic. So in my career, I've actually worked in about 5 different HIV clinics, but the Positive Health Clinic seems to be the most comprehensive one that I've worked in. I also help down at the clinic whenever I can make it down there. We're so grateful for your help. I just think it's so multidisciplinary, and I just love that all of the people from the different specialties coming together. Myself as a pharmacist, I'm able to help out with drug interaction questions or medication questions, or even if patients need adherence counseling. So I've always enjoyed being able to be down there, and my resident gets to go down there too, and it's such a great, wonderful experience. Annie, can you share a little bit about some ways that the clinic supports patients who are newly diagnosed with HIV?
Absolutely. As you can imagine, a person first finding out their HIV diagnosis is a very overwhelming time for them.
Sure.
There's a lot of information they have to process. Depending on what their previous knowledge or awareness of HIV is, they may think that it's like it was, 30 plus years ago.
Right.
They may not understand the advances we have in treatment, how well people do. There's a lot of education that I'm providing to patients when they're first referred to our program with a new diagnosis, making sure that they have linkage to any support in terms of insurance coverage. Obviously, managing a chronic illness is expensive, and so we want to make sure that if they don't already have insurance, that we're referring them to the community support resources that will get them applied for all the programs that they would need, and then helping them learn how to become their own best advocate so that they feel confident not only managing their HIV but their overall health and wellness.
For sure. Yeah. A lot of great things happening there at the clinics, definitely positively impacting patients' lives.
I'm always making sure to point out to our newly diagnosed patients that my oldest patients right now are in their 70s and 80s, and they're thriving. They're thriving. Yeah. So that's always encouraging that when people hear that.
Oh, for sure. Definitely. Like you said, it's so different than how it used to be, which actually is a great segue into my next question, is just shedding some light on the treatment strategies that we have now. Treatment has come a very far way from back in the day. I remember initially there were very, very few treatment options for patients. And then even as I was in school, the recommendations for treatment, they weren't very clear cut. It would say, well, you can choose 2 medications from the backbone and then pick a third medication from one of 3 different classes. Sometimes there were a lot of medications to be taken with a lot of pills multiple times a day. So we've really come a long way from that. Annie, do you want to share what treatment typically looks like today?
Treatment right now is pretty exciting. And you're right. We know that HIV responds best when it's treated with multiple medications. And so 20 plus years ago, people were taking multiple pills multiple times a day. Right. And oftentimes those regimens gave patients a lot of difficult to manage side effects.
For sure.
Stomach upset, just all sorts of side effects that made it hard for people to really stay on it long term because it made them feel poorly. The medications we use now are 1 pill once a day combinations that are much easier to tolerate. They have far fewer side effects in terms of interacting with other medications that a person might be taking. So they're just a lot easier to take. But I don't want to minimize how tough it can be to maintain good daily adherence. So I'm always encouraging our folks to do the best that they can. Nobody's going to be perfect all all the time. And the medicines that we have now, if they do have an occasional missed dose, it's not going to lead to any long-term harm. So we're reassuring them on that point as well. The other exciting thing about HIV treatment is we now have a long-acting injectable option. So for people that are eligible, if they're interested, they can come in and receive a series of 2 injections once every 8 weeks and not have to take any oral medication for their HIV treatment at all. It's a really exciting time to be a part of HIV treatment.
Incredible, yeah. And I'm just thinking back to how far we've come across the years. You know, we always talked about these long-acting injectables, but they're finally here and they're finally being used in patients with really good results as well.
Yes, yeah.
So we talked about treatment, but sometimes the best treatment is actually prevention. So I wanted to ask you about pre-exposure prophylaxis and also post-exposure prophylaxis and some advice that you have or information that you have on that.
Absolutely. I'm always surprised. There are folks in the community and even healthcare professionals that aren't aware that HIV pre-exposure prophylaxis exists. So there's both oral pill options for HIV prevention and also another long-acting injectable option. So the idea is that you can have medication in your system that, should you be exposed to the HIV virus, would prevent you from becoming HIV positive. I think of it sort of like applying sunscreen to prevent a sunburn in case you're going to be exposed to the sun's rays.
That's a great analogy.
And the idea is that if you're taking the medication daily, or if you come and attend your injection appointments, you can very safely and successfully prevent any kind of HIV transmission if you're exposed. I think it's important for patients to know it's an option so they can go to their healthcare providers and request it. It does require management by a healthcare provider, so there would be some laboratory testing that you'd need to have completed before you started the medicine, and then also periodic monitoring and follow-up. But patients can go to their primary care providers. The infectious disease department has a dedicated nurse practitioner who's seeing patients for PrEP treatment. She can also do that virtually, which helps expand it for folks if they maybe can't travel to Morgantown. And I'm always reminding students that are a part of the university healthcare system that they can go to Student Health for PrEP as well.
Yeah, for sure. And it's very, very effective. It can reduce transmission rates by about 99%. So
yes, it's extremely
PrEP is
effective.
very, very effective.
So much so.
Post-exposure prophylaxis?
Post-exposure prophylaxis is a little bit different. It started as a concept when, if people that were working in healthcare or say first responders were exposed to exposed to the HIV virus in a healthcare setting, they were offered antiretrovirals that they would take for a month to prevent HIV seroconversion, where a person goes from HIV negative to HIV positive. And what we also found is that you can use those same medications if someone has an exposure, say they find out after an encounter that the person that they were intimate with were HIV positive. The important thing to keep in mind about post-exposure prophylaxis is it really needs to be taken within that initial 72-hour window. So sometimes if people don't know it's available and they go online and they do research, say a week later, they've missed out on that window to start treatment.
Yeah, that's why it's very important that we're covering it today. So thank you for mentioning that. Can you talk about what are some of the biggest challenges in managing HIV treatment today?
I think in West Virginia, we face a few tough barriers, and that's why I think it's so wonderful that we have a full team to really help patients work through those different challenges. Just the rural nature of our state makes transportation difficult. There's only 2 programs like ours in the whole state. We're located here in Morgantown, and there's a Ryan White funded clinic based out of Charleston, but that's a lot of distance for patients to have to cover to get HIV support and care. And so it's not uncommon for our patients to have to travel 2 + 3 hours even one way just to come and see us for care. So helping patients manage that is always a big challenge. Access to insurance coverage. So if a person might be working but they don't qualify for, maybe they don't have offered to them employment-based insurance and they don't qualify for Medicaid. And so making sure they understand that there are other ways, other systems in place that can help them. But usually those systems involve paperwork and appointments and